Welcome, Synapse community. Kelly Becker here, and welcome to another resource video in which we will be helping you navigate your Parkinson's journey. One of the most requested resources that we get is for more resources around Parkinson's medications. And so we have thrown together some resources for you that we commonly refer people to so that they can be learning more about the medications they are curious about taking or are currently taking. In this video, we will be going over who to talk to about your medication strategies, when and why you might start medications for Parkinson's, review what on and off times are for the common Parkinson's medications, and how to learn more about these medications, as well as some special considerations. So, the resources that we most commonly refer people to, which we'll be bringing up in more detail on this video, are the Parkinson's Care Summary for Health Professionals and the Every Victory Counts Manual from the Davis Phinney Foundation. Now, we have referenced both of these resources in previous videos on different topics, so hopefully you have these resources at this point in time already, and you can just be turning to the right pages to help you with this. But if not, I have the links at the end of this video for you to get a hold of those resources yourself. So, a little bit of background. Medications are obviously a very important part of the overall care for Parkinson's. Most people that have Parkinson's are taking some type of prescription medication to manage it. And there are many professionals, and you should be working with a professional who is trained to help you manage your medications. That includes neurologists and your movement disorder specialists. That's the most common healthcare professional that's going to help you with this. It can also be your primary care provider, your pharmacist, and physician's assistants and advanced practice nurses that work in those fields. When might you start medications for Parkinson's? So I get this question a lot because we often encounter people that are newly diagnosed with Parkinson's, and maybe they haven't started taking medications yet, or they're curious about when they should. So the general rule of thumb, obviously, is that this really depends on the person and the symptoms that they're experiencing. So what we typically say is start when your symptoms become disruptive to your life. Okay, so that could look like, are you giving up activities that you have previously enjoyed, whether it be work related activities, hobbies, things that you do with your family or friends? Are you having to give up any of those things? And are you making accommodations that seem unreasonable at this point in time? Maybe you've been avoiding certain things that you used to do for yourself. Maybe you're no longer trying to wear that button-up shirt or things like that. So there are definitely lifestyle strategies that we can use to help with these things too, and therapies like physical therapy and occupational therapy that we can engage in. But these are also a great criteria of when to start medications for Parkinson's. And then just beyond the radar, there are a lot of myths out there about Parkinson's medications. And one of the most common ones that we hear is that people don't want to take them because they feel that they only work for so many years and they don't want to use up all those years right away. And this just simply is not true. So if you have questions about that or other potential barriers or maybe things that you've heard about Parkinson's medications that you're not sure of, please talk to your healthcare provider about these questions that you have. So, the best medications for you really depend on your symptoms, your age, the years that you've already been living with Parkinson's, and risks that you may have for side effects of the medications. The strategies that you use will change over time, depending on if you have mild, moderate, or advanced symptoms. So, this is a common thing that as time goes on, people add in or take away different Parkinson's medications or increase the dosages for what they're taking. Carbidopa levodopa is the gold standard, and it is the most commonly prescribed pharmacologic therapy for Parkinson's. So I am going to guess that the majority of the people that are out there watching this video today are taking some form of carbidopa levodopa. So, on that note, any type of dopamine medication therapy has the potential to cause on and off times when it comes to symptoms. So, you may have heard of these terms, on times and off times with medications. But some people don't really understand what that means, especially if they are new to taking these medicines. So, what is on time? On time just simply means that that dopamine is in your system, right? It is fully on board. If you've been taking it in pill form, it's gone through your digestive system, it's gotten to your central nervous system, and it is doing its job. And that is usually the time that you feel a decrease in your Parkinson's symptoms, maybe less stiffness or rigidity, less tremor, maybe just a general sense that you can move better or feel better. This is different for everybody. Not everybody has the same experiences with these medications. And there are certain things that you can do to improve the on time with medications too. That means like simply just drinking enough water, which is important for other aspects and symptoms that people have too, especially hypotension or dizziness. So, drinking plenty of water. Can help increase the effectiveness. Managing constipation, which is another issue that a lot of people deal with. So, making sure that your GI system is working well so those medications can be absorbed. Also, they're limiting protein intake around medications. So, this can be a little tricky for some people, especially if you take your dopamine or your carbidopa, levodopa multiple times a day. But generally speaking, people recommend anywhere from 30 to 60 minutes before or after to limit protein intake because it can make it so that the medication is not absorbed as well into your system. Other things to look out for are other medications that you might be taking that do not mix well with carbidopa levodopa. So again, ask your healthcare provider about your specific concerns that you may have. Now, what is dyskinesia? So, dyskinesia simply just means abnormal movement. And you may have experienced this yourself, or you may have seen it in somebody else. And it's that writhing and kind of wiggling movement that occurs during on periods of medication. I just realized that in the previous slide, we forgot to discuss what off times are. They are simply the opposite of those on times when the medication is not in your system any longer, and you may return to having more of those Parkinson's symptoms. So, back to dyskinesia. Again, it's that abnormal movement that occurs during those on periods of medication. And it can actually occur outside of medication use too, just simply as a symptom of Parkinson's, but it is by far mostly associated with the use of Parkinson's medications that increase dopamine in the brain. We find that this may or may not be bothersome to the person who has Parkinson's. Oftentimes, the person with Parkinson's may not even be aware that they are doing those wiggling movements. And even if they are aware, sometimes they say, well, it doesn't bother me. However, if this is something that's bothersome to you, talk to your neurologist or whoever is prescribing your medications about adjustments that can be made to potentially curb this from happening. So, when it comes to your options for medications and Parkinson's, we've already talked about the gold standard being carbidopa levodopa, but there are actually many different classes of medications that you can be taking. This is a list of them here from dopamine agonists to MALB inhibitors, COMT inhibitors, amantadine, anticholinergic medications, and adenosine receptor agonists. So, it is way beyond the scope of this presentation to go into depth about those and what they do. But this is where I really want to make sure that you refer to those resources, again, that you hopefully have already, but if not, you can download them today. And I'm going to share them with you right now. So, the Davis Finney Foundation. Again, wonderful organization that has our favorite resource, the Every Victory Counts manual. You can get a hard copy for free, just pay for shipping, or you can get a completely free downloadable copy from their website. Again, we'll have the link at the end here. But chapter 7 in this manual is all about medications, and they go into a great level of depth about those medications. So please, that whole list that we had before, they go into review about these. Here is just one snapshot of one of the pages where they list all the carbidopa levodopa medications, and they have a similar chart for each of those classes that were on our previous slide. The great thing about this is you can see what the generic name is of the medication. You can see what the trade name is and notes to where you can find out more information. It also gives a little synopsis um, of important information related to that class of medication. As you can see, they also go on this page to start talking about dopamine agonists, and the next page would also have these charts about those. So I highly recommend, again, it's beyond the scope of this presentation, but I highly recommend that you look into the manual if you have specific questions about medications that you might be taking or are considering taking. They also have a list in here of medications that you should not take when it comes to having Parkinson's or that do not mix well with Parkinson's medications. So, in that manual, they also go into detail about non motor symptoms. So, all of those medications that we were previously listing are all for treating the motor symptoms, the movement symptoms of Parkinson's. But of course, there are many aspects of Parkinson's outside of those movement symptoms, including depression, constipation, drooling, fatigue, overactive bladder, pain, that hypotension and dizziness, dementia, hallucinations, sexual problems, and sleep issues. So, in that manual, they also have recommended medications that you might be taking for any of those issues. So, a great thing again is that they list in there things to watch out for and things that might be options within each of these classes. So, go ahead and check that out. Now, our last topic that we want to discuss in this presentation is hospital stays. So, we have done a whole presentation before on preparing for a hospital stay. Um, and this is a really important topic when it comes to medications. If you know in advance that you're going to have a hospital stay, or even if you don't know in advance, it's a good idea to have an updated list of your medications prepared, including what you're taking, the dosage, and how many times or when you take it per day. 1 in 3 people with Parkinson's are given medications that they shouldn't be given, contraindicated medications during their hospital stay. And so bringing that list in can be very helpful for your providers to know what you are currently taking and what might not be good to mix with it. We really want you to help inform your healthcare providers of how important it is to be receiving your medication on time when you're in the hospital. Really common that when you get admitted to the hospital, they give you medication on their nursing schedules. But this just does not work well with Parkinson's. You need to be taking it on your schedule. So, on the next slide, I'll show you a resource that you can give to them to help with that. There are also some medications that can worsen Parkinson's symptoms that might be commonly given during a hospital stay. So it's good for people to know about that. And bring in your hospital safety guide from the Parkinson's Foundation, which is what I'm about to show you. So this is just one of the sheets from that hospital guide. And this is part of the information that you can provide to your healthcare providers in the hospital so that they have a better understanding about what to be looking out for with Parkinson's and what medications do not go well with Parkinson's. So this is so helpful. I love this that, again, they are really reiterating these 5 Parkinson's care considerations, that it's important that you get your medications on your schedule, that it is not delayed in any way, that they avoid certain medications, especially when it comes to medications that are used for hallucinations or dementia or things like that, that they are not using medications they shouldn't be. That movement should be really prioritized, right? You should be working with nursing and physical therapy to get up and out of bed. That will help a lot of your symptoms, and to be on the lookout for swallowing difficulties that people deal with a lot during their hospital stays. So they have this excellent caution on here that there are certain types of medications, benzodiazepines, muscle relaxants, bladder control medications, as well as others that really may lead to confusion, hallucination, falls, and other symptoms. And boy, is this true. We have had Many people in our programs that have talked about experiences that they have had in the hospital with being given these medications and the really bad effects that they had from that. So be on the lookout for that and inform your care providers. So that is it for our brief review on medications for Parkinson's and where you can get more information. Again, our takeaways were that medication management is unique to each person with Parkinson's, that you should be talking with your neurologist or other qualified provider about your strategies that you can be using when it comes to medication. Learn about what you're taking, right? Don't just take what is given to you, understand what it is. Look it up in that manual that we referenced so that you have a better understanding. Learn what impacts the effectiveness of your medication and know what medications you should not be taking. And the last point was being prepared for a hospital stay. So, as I said before, here are the links to those two resources. You can go to parkinson.org and look up their hospital safety guide, where you can get that information to give to the healthcare professionals when you are in a hospital stay. And even more importantly, at the Davis Finney Foundation, you can simply go to this is the long one here, but you can just go to dpf.org and download your own free manual today. All right, that is it. I hope this was helpful for you, and we'll see you next time. This video is brought to you by Synapse Fitness Foundation, a nonprofit empowering people with Parkinson's to live their best lives through exercise, education, and connection to others. The presenter of today's video is Dr. Kelly Becker, physical therapist and founder of Synapse Fitness Foundation. If you found today's video useful, please click the like button and forward this video onto somebody that you think would find this useful. Thank you.